and we are so excited to have Claudia with us today to talk about professional development for ECE providers. So please help me welcome Claudia.
Thank you. Good afternoon, everyone. I'm really happy to be here and have the opportunity to share some of our experiences, our successes and our challenges around professional development for the early care and education workforce. I wanted to start my presentation with this graphic. How many of you have seen this graphic? It's from the Institute on Medicine report on transforming the workforce. And I saw a couple hands go up. What I really like about this graphic is that it really highlights the multiple systems as well as the factors that go into influencing positive child outcomes. It's a pretty messy system. And I think where I'm going to focus my comments are in the middle of that graphic around the knowledge and competencies of our caregivers and teachers, the personal well-being of those caregivers and teachers, and then also what can we do to influence the behavior of our practitioners and teachers. In that same IOM report, they identify on the left side of the slide there the characteristics of high-quality learning. I think we all know those. They're intentional, they're ongoing, they're coherent, they're collaborative. They're tied to practice, they're responsive. But I think there are some really unique challenges that probably everyone in this room knows about that face the ECE workforce when they try to access training and professional development. And I've listed those on the right, that professional development has to be accessible. It has to be affordable, especially for small programs, for family child care. It has to be relative to the specific practice environment, again, home-based versus center-based. It has to be specific to the roles and the age groups of the children. And then we throw in that pot diverse learning styles. We have millennials in the workforce with people who have been there for a longer time. They learn differently. They want to access information differently. We have diverse educational levels, and I'll talk a little bit about that and our experience with that. And then I think one of the biggest challenges is once we deliver training, how do we support that training in a way that's cost effective with some kind of technical assistance or coaching that's going to reinforce what they've learned and the knowledge and competencies that they've gained. This is just a snapshot of the Better Kid Care program. We have an online training program. We launched it in July of 2011, and since then we've had over 100,000 early care and education professionals log on and take about, probably more than this now, 450,000 modules. So we've had a lot of experience in the online professional development field, and I wanted to put this snapshot on here because you can see the diversity of the people who are accessing training or who need training and need professional development. You see diversity of experience, diversity of roles, diversity of practice settings, and then also diversity of families served. You can see almost half indicated that they participate in CACFP, a little more than a third. Less than, or almost a half are in the profession less than 5 years. So we have a lot of new professionals coming to the field. This, however, slide I think is the most striking demographic that describes our audience and our on-demand learners. 48% of the folks who are coming to take professional development with us only have a high school diploma or a GED. And what that means to us is we need to really make our messages and our professional development understandable and meaningful. That translation of research to practice is so critical. It means different things for different people, but we need to figure out how to make those messages understandable. As we think about our priorities, I go back to the model where we're looking to impact positive child outcomes. And we really see three priorities. These are three areas we've tried to focus on at Better Kid Care. The first one is what we've been talking about, science to practice. How can those messages make sense to the teachers and caregivers? How can we help caregivers be role models? They're with the kids most of the day. They're the ones who need to understand healthy behaviors and healthy practices. And also caregiver wellness. I'll talk a little bit about that. And then I think one that maybe we've ignored a little bit is how can we engage the caregiver or the teacher in helping families connect to other services. We found that many of the caregivers and teachers don't understand the services to be able to refer them. They don't know about CACFP. 25% of people who responded to the question, do you participate in CACFP? We said, yes, no, I don't know. 25% of those people said they don't know. So we're thinking, either they're not in a position to know or they really don't understand what that program is. And that's just an example. This slide shows some of our science to practice modules, and what we're doing is looking at best practices for obesity prevention. How can we increase the health literacy for the caregivers? And what are those best practices for implementing those practices? And you can see we've highlighted on the right of the screen our Let's Move Childcare series. That was a partnership that we had with the CDC and the Let's Move folks. We think as part of any professional development, there has to be a way where you can show the best practice. They either need to see it or you need to demonstrate it. Again, making that message understandable. The learning needs to be tied to practice. And a lot of caregivers and teachers know what the best practice is. They know they should be serving family-style meals, but they don't know how to. And so anytime as part of that professional development, we can say, this is how you can do it, and we can talk to people who have done that. Another key component that we try to include in all our professional development is an opportunity for reflection, for the learner to be able to think about their specific practice setting, and then what does that mean for them? How can I apply that? And so we try to integrate, here you see an action plan. We do checklists, knowledge check, reflective questions. Here are some things you want to discuss with your center director, bounce an idea off a colleague. We try to integrate those into activities, especially because we're in an online environment. We have done a little bit of evaluation. This is on, again, just an example on the kind of science to practice. We looked at intent to change, and this is one of the, this is from the Let's Move Childcare series. And we asked participants, based on what they learned, how willing are they to make water available as self-serve, both inside and out. And on a 5-point scale, we had a 4.81 mean. So at least someone said small steps. We planted that seed. Oh, I didn't think that I should do that inside and out. We've looked at knowledge gained and intent to change on all of our modules. This one summarizes the Let's Move series. We've had almost 11,000 participants go through that series, and we asked them, again, at self-report, how much did you learn as a result of this, and how much of what you learned are you going to be able to use with the children and families in your care? And this was on a 4-point scale, and the means are above 3. So we're getting very good feedback from the participants. The second area for professional development is really to help caregivers understand their role as a role model for the children. And this is something I think should be included in any professional development that we do, that we develop, that we support, what they're eating, their physical activity level, they're with the children, they're modeling those healthy behaviors. We asked providers about their attitudes towards whether they think they really do have a significant role in helping to prevent childhood obesity. And this was a retrospective evaluation, a kind of post then pre, and we did see a positive % change on that after folks went through our module. And this is another area that I think should be a priority for us as we think about professional development in this area. in addition to modeling healthy behaviors, being a child care provider, being an early care and education professional is a really hard job. It's stressful. We know that, and we need to help those professionals think about ways that they can be healthy emotionally, physically, and be there for the kids, because that's the way to have a positive classroom environment. And with some support from the Department of Defense, we developed a module called Resilient Caregivers, Bouncing Back from Stress, and that's available in our system at no cost. It's free for everyone. And then the last area that we identified as a priority for professional development is this whole idea of connecting, and how can we help the ECE professionals understand their unique role in connecting with families. They're a very trusted person in that family's life, and they really can be someone who can help engage the parents, refer the parents, and also help parents in their own quest, should I say, for healthy living or to serve healthy and fresh foods. Some lessons learned very quickly. We're not going to get early care and education professionals to come to training, to take our training, unless there's a little bit of incentive for them. And what we have found the incentive is, they want the professional development to count. So we've gone through the process at Better Kid Care to get approved through whatever agency does the approving for professional development, whether it's the state child care license, sometimes it's Human Services, and many times it's the CRIS system. We've done both if there's two separate ways of getting approved. We're now approved in 40 states. We feel really good about that. So we provide documentation back to the state that those providers actually took professional development with us. This is a huge incentive for this field. If you just offer a training and there's no credit around it, there's little incentive for them to even show up. Anytime you can align with CDA competencies, align with state early learning standards, align with the new requirement for training around the CCDBG, those are additional incentives. Offering CEUs is very important in some states. And then I think it goes without saying, low cost. We have to figure out a way to make this available so that it's affordable for this audience. And then the last one, access to technical support, especially if you're doing it online, and user-friendly. We found the fewer bells and whistles, the easier it is. And our system doesn't have a lot of fancy bells and whistles, and people have told us it's very easy to use. And then finally, my last lesson learned, I think we've heard from some other presenters, and that is we can't do it alone. We have a huge number of partners, and they're partners in curriculum development, they're partners in funding, they're partners to help us spread the word and to scale up and extend our reach, and we're really grateful for that, and continue to look for and engage with other partners as we move forward with Better Kid Care. Thank you.